warahmatullahi wabarakatuh. Good afternoon, everybody. It is my great pleasure to welcome all of you to the guest lecture today on behalf of Medical Faculty of University of Muhammadiyah, Professor Dr. Hamka. Before we begin the session, let's ask our program by reciting Basmalah. Bismillahirrahmanirrahim. My decision bring us blessing, knowledge, and deeply insightful. Allow me to introduce myself. My name is Duyana Cehningrum, an alumna of Faculty of Medicine, University of Muhammadiyah Professor Dr. Hamka. I am a cardiovascular technician, class of 2017. I am currently working as a laboratory cardiovascular in here and education staff, teaching invasive technique from the second year students. Let me also introduce our study program. In medical faculty, there is three program, COAS, medical, and this is the cardiovascular technician. Cardiovascular technician is a study program who has various diagnostic and intervention cardiac technique such as echocardiography, electrophysiogram, vascular sonography, blood pressure monitoring, and cardiac electrophysiology. Graduates of this program is expected to work alongside cardiologists and assisting in the operation of advanced diagnostic and interventional tools for cardiovascular care. Okay, we are truly honored to have with us today Dr. Medhat from Egypt, who will be sharing his valuable knowledge and his expertise. Before we proceed to the lecture, Dr. Medhat is a cardiologist from Egypt, and today program Dr. Medhat will deliver important issue for us. The first is cardiovascular hemodynamic course and maybe pressure. Yeah, okay. Thank you. Okay, before we begin, I kindly remind the audience, after the Dr. Medhat lecture, there will be Q&A session. Yeah, so please prepare your question and mention your name. Without further delay, let us warmly welcome Dr. Medhat to deliver his first lecture. Dr. Medhat, floor is yours.
السلام عليكم ورحمة الله وبركاته. This is a great pleasure for me to be with you today. I would like to thank Ohamka and thank my colleague, Dr. Dui, for inviting me today to be with you in the cardiovascular technician course. Let's start with a question. You know the cardiovascular hemodynamics? Anyone knows that what is meant by hemodynamics? What's meant by hemo? Dynamic. Good. Good. Okay. Before I start, I would be with you also for the echocardiography workshop. These the same students that will the same students. Okay. Then I would make the best use of my chance today to give hemodynamics and the invasive and the fundamentals of echocardiography in between. Okay, because they are interrelated together. Please don't be shy. Don't be shy to and don't hesitate to stop me and ask. Because if you don't understand, there is no benefit that you are here. Then you should understand, and if you don't understand, raise your hand, ask me to explain more. I will try to explain everything from basic to the advanced level, but uh, uh, I will see how you interact with me. If you don't interact with me, then I'm going to sleep. Okay? Okay. Let's start. What's hemodynamics? Why do we need to study hemodynamics? Number one, a lot of critical decisions regarding patients' management depend on hemodynamics. Okay? For example, if the patient has low blood pressure in the cath lab, you know the cath lab? Okay. If we are in the cath lab and the patient has blood pressure of 80 over 40 milliliter mercury, this is profound hypotension, this hypotension. Then, if we are not, if we don't know the hemodynamics, we will not give the patient the chance to live. But uh, if we know hemodynamics, we will know why the patient is collapsing and give the appropriate treatment. Then the critical decisions start from knowing the hemodynamics. Number two, a lot of drugs and interventions affect hemodynamics. So we should study these hemodynamics, and the development of new solution for cardiovascular disease depends on deep understanding of hemodynamics. My colleagues, my technician colleagues that stand beside me during cardiac catheterization, they several times helped me and invented and discovered a new way to manage the patient. I used their thoughts to manage the patient because they have deep insights about the hemodynamics. So they can suggest, oh doctor, you can do this, you can inflate the balloon here, you can do, you can withdraw blood, you can inject adrenaline. They tell me that they are not just technician, they do without thinking. No, a technician should have the knowledge, then the practice. You are not only practicing and flushing the line and connect to the ECG. You should understand what you are doing. Okay? Okay. Hemo means blood, and dynamics means flow in vessels. Okay? Then hemodynamics, the flow of blood in vessels. What's blood? Blood consists of plasma and cellular elements. The plasma constitute about 55% of the blood, and is 90% water. Isn't plasma? Then plasma is water, 90%, and 10% something other are dissolved in plasma. The cellular elements like red blood cells, white blood cells, platelets, they have intracellular fluid also with water. Then you should know that the blood is made mainly from water, okay? And water is incompressible. What's meant by incompressible? That cannot decrease the volume with pressure. Volume is constant despite applying a pressure. If you have here a bowl that is full of water, if you sit on it, if we bring an elephant from Thailand and sit on this bowl, the volume of the bowl will not change, will not compress, because fluids, liquids, water is incompressible. What's meant by incompressible? Cannot be compressed, cannot be decreased in size with pressure. Okay? One should think the bowl will burst and the water will get out. Yes, but water will not decrease in size. If the bowl is full with air, can be compressed? Yes, air and gases can be compressed, but water is not compressed. So blood is incompressible because it's 90% of plasma is water, and the cellular elements also have water, okay? Then what's pressure? Pressure as you know from your past study, pressure is the perpendicular force acting on the unit area. When you hold a pencil like this, like in the picture, and press, you will feel pain in your thumb or your index finger here. Why? Yeah, above, the same force, down and up, the same force. But here, down, the area is big, so the pressure is low. Above, the area is small, so the pressure is high. Because pressure equal force over area. Then, when the area is low, the pressure is high or low? You are sleeping? I will sleep. Again, if the area is small, the pressure will be high or low? High. If the area high, so the pressure at your index finger above will be higher. So we feel pain. Okay? Okay. Then the pressure, we call the pressure at the atmospheric pressure. You mean, you know the atmospheric pressure? The atmospheric pressure is what? Is the pressure of this air column at the sea level. As you see here, at the sea level, there is a pressure of air. The pressure of air tells the atmosphere above. This column of air has weight. This weight has a pressure here. The pressure here is equal 760 millimeter mercury at the sea level. This is what we call the atmospheric pressure. You know, this atmospheric pressure. Okay. Look, this is the hand. When we puncture the radial artery, if one puncture or make a tear of the break of the radial artery. Do you know radial artery? Where is the radial artery? Where is the radial artery? Your radial artery where? Give me where? Your radial artery? Yeah. Here is the radial artery near the radius. Okay. If we puncture the radial artery, we cut the radial artery, the air will enter or the blood will go out. If you puncture or cut the radial artery, what will happen? The air will enter blood and the radial artery, or the blood will go out? Blood will go out. Then, what is the pressure? Which compartment has the highest pressure? The air or the blood? The blood. Right. Then, what is the blood pressure? What's your blood pressure? What's your blood pressure? Do you know the normal blood pressure?
120.
She says that blood pressure is 120 over 80. Yeah, 120. The maximum blood pressure is 120, but the atmospheric pressure is 760. Then how the blood goes out from 120 to 760? You imagine? If the atmospheric pressure is higher, then air should enter the blood. And if the blood pressure is higher, then blood goes out. The atmospheric pressure is 760. The blood pressure is 120, but the blood goes out. Then the blood pressure is 120 more than the atmospheric pressure. If we consider the atmospheric pressure 0, then blood pressure will be 120. That means then the atmospheric pressure is 760 milliliter mercury. We consider it 0. Then the blood pressure equal 120 milliliter mercury plus 760. You know? Then, but we will consider throughout our study that the atmospheric pressure is 0. Then when I ask you your blood pressure is 120, that means 120 plus 760 of the atmosphere. Okay? You got it? Okay. Then what if we perform a pressure tracing of the right atrium? Okay? Please give me your concentration and attention. If I introduce a catheter into the right atrium, okay, and it measures the pressure, it says that the pressure is -2. How the pressure become -2? It's not -2 below 0. -2 means 758. Okay? And then pressure in the human being will consider atmospheric pressure 0. Okay? And we call plus 120 minus 30. That means in relation to the atmospheric pressure. Okay. Here the pressure. The pressure is the perpendicular force acting on unit area. Then the blood, while is traveling in the blood vessels, have pressure perpendicular force on the area like the arrow, this arrow. This diagram shows the blood pressure during the cardiac cycle. Is the blood pressure stable or fluctuates? Blood pressure is 120 all over the cardiac cycle or fluctuates? It increase and decrease. Reach 180, 120 at systole and decrease to 80 at the end of diastole. Do you know this information or not? When the heart pump blood in the aorta. This is the aorta. You see? Okay. This is the left ventricle. And this is the aorta. If we put a catheter in the aorta, the ventricle, when it contracts, it pumps blood in aorta. So the blood pressure in the aorta rise to 120. Then the aortic valve closes. The ventricle stop pumping to perform diastole. Is there any blood entering the aorta during diastole? Is there any blood entering the aorta during diastole? The ventricle in diastole is relaxing. Relax. Don't pumping blood. Doesn't pump blood. So the aortic valve is closed. No blood entering the aorta. But the blood is leaving the aorta. So the blood pressure in the aorta will decrease. Decrease. Hop. Then the second cycle come again. And the ventricle contracts. So it pumps blood. The blood pressure rise to 120. Then decrease to 80. And then, so this is systole. This is diastole, or the systole and diastole. Okay? Then the maximum blood pressure is 120. The lowest blood pressure is The lowest blood pressure is 80. I'm talking fast. Slow down. Slow down. Okay. The maximum blood pressure is 120. The lowest one is 80. Can you give me the mean? During cardiac catheterization, the hemodynamics, the machine, will use the systolic blood pressure, the diastolic, and the mean. Do you know what is the mean? Like the average? How we calculate the mean? Aywa, please.
120 plus 80. Yes, 2.
Your name?
Abi Umar.
Abi Omar. Abi Omar. My son is called Omar. أنا أبي عمر. Abi Omar said that to calculate the mean blood pressure, mean, okay, like the average, we will have the systolic blood pressure plus the diastolic blood pressure divided by 2. Who agree with Abi Omar? Show your hand. If you agree, raise your hand. Who agree? Can we calculate this blood? They don't understand me, or they don't want to share to participate. Who don't agree with Abi Omar? How to calculate mean blood pressure? He says we calculate mean by systolic plus diastolic over 2. The maximum plus the minimum divided by 2. Who agree? You don't agree? Why you don't agree? Agree. Why don't raise your hand? Again. Who agree? If you don't agree, I will ask you. Who agree? Then you don't agree. Why you don't agree? I got it. The AI on her mobile says that mean arterial blood pressure بيساوي equal diastolic blood pressure plus 1/3 pulse pressure. This is not the equation. Okay. How this come? First of all, to understand this, we should know what is systolic blood pressure. What's systolic blood pressure? This is the maximum or the minimum? Oh, please. Please answer me. Systolic blood pressure is the maximum or the minimum? The maximum pressure during systole, peak systole. Okay. Diastolic blood pressure. The maximum or the minimum? This is the minimum blood pressure at the end of diastole. Okay. What's pulse pressure? Pulse pressure is the pressure that is make you feel the pulse. I ask a question. If the blood pressure is 110 over 105, if the blood pressure 110 over 105. And if the pressure is 90 over 60, who has the highest blood pressure? Person A or B? A blood pressure is 110 over 105. But B blood pressure is 90 over 60. Who has the lowest blood pressure? B. If you feel the pulse, which pulse will be bigger? A or B? If you put your hand on the radial pulse of A and you put your hand on the radial pulse of B, which one will have the biggest pulse? A or B? If you agree with A, raise your hand. If you agree with B, raise your hand. No one? No. 1, 2, 3. Can you explain why you choose B? Or you don't want to? Another question. If the blood pressure is 110 over 110, what does it mean? What does it mean? The blood pressure is 110 over 110. The blood pressure fluctuates or steady? If the blood pressure is 110 over 110, that means what? Means the blood pressure is like that. It's not fluctuating. Then if I put my hand on the radial pulse, I will feel pulse? No pulse. What makes you feel pulse is the difference between the systolic and the diastolic blood pressure. And when the difference is big, you feel a better pulse. When the difference is small, you feel small pulse. Okay? Here, person A have 110 over 105. The difference is 5 only. But here, 60 over 90 over 60, the difference is 30. This has a bigger pulse. Okay? You are right. What? So, what's pulse pressure? Pulse pressure is systolic blood pressure minus, you got it? Why we call it pulse pressure? Because this is the difference that make you feel the pulse, okay? Then, most of the time of the cardiac cycle of one beat is in systole or in diastole, or it is equally divided between systole and diastole. Again, the question is, this is the duration of systole from here to here, okay? And the duration of diastole from here to here. Is the time for systole bigger or diastole bigger, or is it equally divided? Here, this is the time of systole, and this. Then, which have more time? Please answer me. Diastole has more time or systole has more time? What? Has more time. Here, this is time. This is pressure. Systole has only this, but diastole has all of this. Then the time for diastole is double that of systole. Okay? Do you got it? Have you got it? Then, if we want to calculate the mean, this is systolic blood pressure, as Abi Omar said, systolic blood pressure, and this diastolic blood pressure. If the wave was like that, half in systole and half in diastole, then we take systolic blood pressure, the diastolic plus diastolic divided by 2. But here, the duration of systole or diastole is more. Which have more duration? Systole or diastole? Have more time? Diastole. So, diastole have double the systole. For this, when we calculate the mean, we calculate 1 systolic blood pressure plus 2 diastolic blood pressure over 3. Then how we calculate the mean? Not systolic plus diastolic over 2. Why? Because diastole has more time, has double the time. Then we take 1 systolic blood pressure plus 2 multiplied by diastolic blood pressure divided by 3. Okay, can you remove systolic blood pressure and put diastolic and pulse pressure? Here, pulse pressure equal systolic minus diastolic. Then systolic equal back to KG1. Come back to KG1, KG2. Systolic blood pressure equal what? From this equation. Pulse pressure equals systolic minus diastolic blood pressure. Then systolic blood pressure equal pulse pressure plus diastolic blood pressure. Okay? I will do this. I will remove systolic blood pressure and add pulse pressure plus diastolic. How many diastolic we have here? 3, 2 plus 1. Okay? Then it will be like this. Here, 2 plus 1 equal 3. Then we have 3 diastolic blood pressure over 3. 3 and 3, then 1 diastolic blood pressure. 1 diastolic pulse pressure divided by 3. This is the equation that AI gives you. Here, mean blood pressure equals the diastolic blood pressure plus 1/3 of the pulse pressure. Okay? Let's practice. Okay, let's practice. What if one has pressure 120 over 90? Who can calculate the mean blood pressure? This is the equation. One patient have blood pressure 120 over 90. How can we calculate it? Who want to share? Okay, you want to share. Come. Come. I will take you next time. Here, what's your name?
Fikri.
Fikri. Fikri means fikr, thinking. Okay. Fikri, here, this is the systolic blood pressure. Okay. Systolic blood pressure, 120. This is the diastolic blood pressure, 90. Please calculate the mean. Here, diastolic blood pressure equal 120 or 90? 90, okay. What's the pulse pressure? Don't talk. Pulse pressure from here is systolic blood pressure minus diastolic blood pressure. This is systolic, this is diastolic. Minus 90 equal, excellent, 30. Then 1/3 of 30 is 10, excellent. Then 10 plus 90? 100. Excellent. Great. Great. Then the mean blood pressure of the patient who is 120 over 90 millimeter mercury is 100 millimeter mercury. Okay? Okay. We have told you that hemodynamics mean blood flow in vessels, and the Pascal law that our fluids are incompressible. Bypass this and go to the blood velocity. Okay? What's meant by velocity? Speed. Okay? This is the distance traveled per time. Do you know the continuity equation? No. Anyone knows the continuity equation? This will be used in the echocardiography hands-on workshop. Concentrate, because I will not tell you anything about it again. Okay? I will explain it once today, and we will use it in the echocardiography course. Please concentrate. Okay. Here is a tube or pipe with different area. Okay? Large area and small area. Then we know that blood is made of water, and water is compressible or incompressible? Incompressible. Can we compress water? No. Then this is water. Water will enter from here and exit from there. Here's the volume of water entered per minute or per second, per time. Should equal here or be more or less than volume exit per time. For example, if 100 milliliter enter per second here, 100 milli enter per second here, how many milliliters will exit from here per second? 100, more or less? If you choose more, then from where water come? If you choose less, then that means 100 enter, then exit 5, exit for mass 80, then 20 where have gone? There is no sideways. So this 100 also. Listen, the volume entered per time equal the volume exit per time. This is called flow, or we call it Q. Okay? Then Q1 equal Q2. This is called continuity equation. What's continuity? This tube is continuous, have no sideways. Because it's continuous, then the volume, the flow entered equal the flow exit. Okay? Okay. But the velocity. If you have a pipe, a rubber pipe that's connected to water, and then a water source, then you open it to make watering of the tree or something like that. Then if you push the neck here, you press here, what are you doing with the area? What are you doing? What's your name?
Delova. Delova.
Okay. What's your opinion? If I put a push or press over the neck of a rubber tube, coming out water will come faster or slower?
Faster.
Excellent. It will come faster. That means more flow or more velocity? More velocity, but not more flow. The flow here equals the flow there. Flow does not change because of continuity equation tells us that the flow is constant here and there, but the velocity is higher. Why? Because blood velocity here, A1, the area 1, V1 equal A2, V2. Here. Here's the bigger area, okay? Area. But velocity, small. Here, area, small. But velocity, this equals this. A1, V1 equal A2, V2. If we decrease the area, the velocity will increase. If we increase the area, the velocity will decrease, okay? This is continuity equation. We'll use it tomorrow or the next time. Tell me, what's your opinion about this question? Regarding the aorta and the capillaries, which have the higher blood velocity, aorta or capillaries, and why? The blood flow in aorta and blood flow in a capillary, in capillaries, okay? Which has the highest velocity? Aorta or capillaries, and why? You want to answer? Your name?
Naura. Naura. With N. N. Yeah.
What do you think? The velocity in aorta is higher or the velocity?
Aorta.
Who agree with Naura? The velocity of blood in aorta is higher. Raise your hand if you agree. If you don't agree, I will ask you. Agree? You don't agree? Why don't raise your hand? Agree? Do you agree? Blood velocity in aorta is higher? Can you explain why? Why velocity in aorta is higher? The AI answers. Velocity of aorta, look, who has the highest area? Aorta is like that. Capillary is like that. Then the area of aorta is big. The area of capillary is small. Because the area is big, the velocity should be small. But take care. This not one aorta come to one capillary. The one aorta come to millions of capillaries. We take the cross-sectional area of all capillaries. The cross-sectional area of all capillaries is much more than the cross-sectional area of aorta. Look, the aorta cross-sectional area is 3 to 5 centimeters square. The capillaries, all capillaries, because this is one aorta, but million capillaries. So the cross-sectional area is 5,000 centimeters square. Who has the biggest area? Capillaries. And so the blood velocity is very low, small. This is a wisdom of Allah. Why? Because capillaries are between cells. the blood flow slowly in order to make exchange, take nutrients and give the blood the waste products. Okay. Okay. Then when we want to emphasize the difference between blood velocity and the blood flow, we use this in the cath lab and the echo. Take care. Blood velocity is the distance traveled per time, but blood flow is the volume traveled per time. Distance can be measured by centimeter. Time can be measured by seconds. But volume measured by cubic centimeter. And time by second. What does it mean? That means the flow, which is volume per time with cubic centimeter, is distance multiplied by area, because this is 1 centimeter, but this is centimeter square. Okay. Then volume per minute is distance per minute multiplied by area. What is distance over time? Distance over time is velocity, then flow equal velocity multiplied by area. Okay. V, then flow or Q equal area multiplied by velocity. Okay. When we need to calculate aortic valve area, and this will be used in echocardiography the next day, Q1 equal Q2, okay? This is called continuity equation. Please give me your attention. Q1 equal Q2. The flow entering equal the flow exit. Then A1, area 1 multiplied by the velocity 1 equal area 2 multiplied by velocity 2. Then if I want to calculate area 1 equal area 2, A2 V2 divided by V1. Okay. Do you know the area of a circle? If you have a circle that radius is R, then the area equal by R square, where pi is 3.14. You know pi? Okay. By R square. Okay. I will remove A2 and place by R square. V2 over V1. Then remove by, put 3.14. Radius is half the diameter. This is radius, and this is diameter. Then I can remove radius and put diameter over 2. Then 2 squared is 4. 3.14 over 4 equal this number. Then this is the equation. We will use this equation during echocardiography to calculate aortic valve area. Remember it, because we will use it again. Who want me to repeat it? Do you want me to repeat it again? If you want me to repeat it again, raise your hand. Okay. Let's repeat it there. Do you have a calculator in your mobile? Okay, help me. I will ask you. Do you see? Do you see here? You can see? And you can see the. I don't think so. It's okay. Here, this is the aorta coming from the left ventricle, okay? Aorta, this is aortic valve. This is the left ventricle, and this is what we call the left ventricular outflow tract. Because the ventricle, this is the outflow below, just below the aortic valve, okay? Okay. The aorta open during systole and the blood goes there. We want to calculate aortic valve area. When the aorta is open, we want to calculate this area. Okay? We will do continuity equation because blood entering here in the LVOT, the volume of blood entering here, we will call it Q1, will equal the volume of blood coming here, Q2. Okay? Then A1 V1 equal A2 V2. Okay? What is the Mesd? We want A2. This is aortic valve area. We need to calculate aortic valve area. We need to calculate it. Then aortic valve area will equal A1 V1 over V2. Okay? Okay. Then A1 is by R square V1 over V2. This will by R square. Here we measure the diameter of left ventricular outflow tract. But we don't need the diameter. R is the diameter or the radius? R is half the diameter. Okay? Then by is 3.14. Radius is not radius, is the diameter over 2. Okay? Squared. V1. Then 3.14. D square over 2 square equal 2 square. 2 by 2. 4. V1 over V2. Please calculate 3.14 over 4 divided by 4. O 7 2 3.14 by divided by no 7 8 5. You have a different calculator. Okay? 785 D square V1 over V2. Okay? Which is measured here? Here, aortic valve area. This 0.785 D1, we can measure it in echocardiography. During echo, we can measure the left ventricular outflow tract diameter. And velocity, we put what we call pulsed wave Doppler of the echo. We will do it by hands-on next time, inshallah. And measure the velocity where at the LVOT, the left ventricular outflow tract. Then V1. and measure the velocity here. Then we have V2. Then we calculate what? Aortic valve area. Okay? Any questions? Any questions? Do you like the information that you have said, or this is very sophisticated and difficult? Difficult? Let's come to a more easier information. We call hemodynamics the flow in vessels. In order for the blood to flow from point to point, from here to there, should be a pressure difference. If the pressure here is 50 and the pressure there is 50, will it be a blood flow? This 50 and this 50. Blood will flow? No. Blood flow if there is a pressure difference. Blood will flow there, from here to there, if the pressure is higher, P1 or P2? P1. But if P2 is higher, the flow will be there. If both are equal, there will be no flow. Okay? Okay. Then I will ask you a question. Which pressure is higher, atrial pressure or ventricular pressure? Ventricular pressure. During diastole, this is the atrium and this is the ventricle. Okay? During diastole, with the AV valve open, the blood flow from where to where? Atrium to ventricle or ventricle to atrium? From atrium to ventricle. Okay? Then the pressure is higher in the atrium than the ventricle. You have a false information that the ventricle should be higher. No. According to which stage in the cardiac cycle? If we are in systole, the ventricular pressure is higher. But if we are in diastole, the atrial pressure is higher because blood is flowing from atrium to the ventricle. So sure, the pressure is higher in, okay. And the pressure gradient is directly proportional to the flow. That means if we increase the pressure gradient, well, the flow will increase or decrease? If we increase the pressure gradient, the difference between P1 and P2, if it is increased, the flow will be higher. But if the difference decreased, the flow will be lower. If we have P1 is 100, P2 is 50. Then if P1 is 100 and P2 is 80, what is the highest flow? The flow will be higher in 100 to 50 or 100 to 80? Which have higher flow? No one can answer? I will collapse here. Your name?
Ria.
Ria?
150.
From 100 to 50, This is a higher flow. The flow is directly proportional to the pressure gradient. That means increasing the pressure gradient, the difference between the pressure, will increase the flow. Simply, if this was 100, will be any flow? No any flow. The flow equal 0. Then, because when the pressure gradient decrease, the flow decrease. Okay. But the resistance is directly or inversely proportional to the flow. Do you know what is directly and inversely? Directly proportional means increasing this A will increase B. Inversely proportional means increasing A will decrease B. We have two parameters. We have two parameters. Here, the vessel, and the blood is flowing here. This blood, okay, or fluid. Blood, in order for blood to move from this point to this point, should have here pressure 1 more than pressure 2, okay? You agree? Okay. And the pressure gradient or delta P is directly proportional to flow. What's meant by this? Increasing the pressure gradient will increase or decrease the flow? Increase the flow, okay? Right. The second parameter is resistance. What if the blood vessel wall is rough, not smooth, okay? Or if it is narrowed, become narrow. This will make change in the resistance, increase or decrease? The resistance will increase. So the flow will decrease. So flow is inversely proportional to radius, to resistance. That means increasing the resistance will make the flow decrease, okay? And then flow equal delta P على R. Like this. Flow equal P1 minus P2 over R over resistance. Here we are going to how to calculate cardiac output and how to calculate mean blood pressure and use how to calculate resistance in the CAS lab. We are studying hemodynamics with invasive cardiology. Okay? Where is the left heart? Red or blue? The left heart. Left ventricle and left atrium. Red or blue? Red. But the right heart is the blue. Okay? This is the systemic circulation. Systemic circulation arises from the left ventricle. Okay? Left ventricle will pump blood into aorta. And the blood will travel to the systemic circulation to return to right atrium. Okay? Here. This is the systemic circulation. From the aorta, arteries, arterioles, capillaries, venules, veins, then in the right atrium. In order for blood to flow from aorta to right atrium, it should be a pressure gradient between aorta and the right atrium. Which will be higher pressure, aorta or right atrium, and why? Which higher pressure? Which has the highest pressure, the aorta or the right atrium? Your name?
My name is Raditya Benafiza. Raditya. Raditya, sir. Radit. Yeah. My answer to aorta, capillary to atrium. Yes. Right atrium.
If right atrium is higher pressure, then the blood should go from right atrium to aorta. But the blood is coming from where to where? From aorta to right atrium. Then the pressure should be in aorta higher than right atrium. Okay? Type. This flow, the flow of blood from aorta to the right atrium per minute equals, is called cardiac output. Okay? What's cardiac output? Cardiac output is the volume of blood pumped by each ventricle per minute. The volume of blood pumped by the left ventricle into the aorta per minute that travel in the systemic circulation and return to the right atrium per minute. This is called cardiac output. It needs pressure gradient and it meets resistance. The pressure gradient between what and what? Pressure gradient between mean arterial blood pressure and the right atrial pressure. Mean arterial blood pressure should be higher than right atrial pressure in order to the cardiac output flow through the systemic circulation. Okay, this blood flow will meet resistance or not? The blood that go out from the left ventricle will meet resistance or does not meet resistance? Meet resistance. Meet resistance in the pulmonary circulation or in the systemic circulation? In the systemic circulation. This is called the total peripheral resistance or systemic vascular resistance. Okay? Can you use this equation to calculate cardiac output? Flow is cardiac output, okay? Equal delta P, pressure gradient between between which chambers? Aorta or mean arterial blood pressure ناقص minus right atrial pressure over systemic vascular resistance. Okay? Okay. Let's see. Here, cardiac output equal mean arterial blood pressure minus right atrial pressure over systemic vascular resistance. Normal individuals, when we measure the right atrial pressure, we found it 0 millimeter mercury. 0 millimeter mercury. Is there a pressure that equals 0? Or you should call it there is no pressure. Again, most of the normal people, when we measure the pressure in the right atrium, we measure it 0 millimeter mercury. What's meant by 0 millimeter mercury? Is that means there is no pressure in the right atrium? If you agree, raise your hand. 0 millimeter mercury means that there is no pressure in the right atrium. If you agree, raise your hand. There is no pressure in the right atrium? Then why you don't agree? Right atrial pressure is 0. I have told you that there is no 0 pressure. 0 means 760. 0 means it equals atmospheric pressure. Okay? We call it 0, but it's not 0. 0 equal 760. Okay. If we considered it 0, then how to calculate mean arterial blood pressure or systemic vascular resistance. To calculate systemic vascular resistance, this is used in the cath lab, and the operator will ask you, calculate the systemic vascular resistance. You should enter some data to calculate the systemic vascular resistance. And accordingly, we give the patient vasoconstrictor or vasodilator. Okay? Systemic vascular resistance will equal mean arterial blood pressure over cardiac output, because right atrial pressure is 0. Okay? Then mean arterial blood pressure 90 milliliter mercury. Let's calculate it. Let's calculate. One that have 120 over 80. Can you calculate the mean arterial blood pressure? Remember, mean arterial blood pressure equal diastolic blood pressure plus 1/3 of the pulse pressure. Okay, diastolic blood pressure. Diastolic blood pressure 80. Pulse pressure is the difference between 140 and 80. Is 120 over 80, 140 over 3, about 13. Then 13 plus 80 equal 93. Let's say it is 90, okay? Then mean arterial blood pressure equal 90 milliliter mercury. Cardiac output is 5 liter per minute. 90 over 5 liter per minute is 18. We call it 18 Wood's unit. Okay? What's 18 Wood's unit? This is the SVR. What's SVR? Systemic vascular resistance. Or we can call it 18 millimeter mercury minute over liter. Okay? From physics, 1 millimeter mercury equal 1,333 dynes per centimeter square. We can, this is another unit used, dyne to measure force. And dyne per centimeter square is used for pressure. 1 millimeter mercury equals this time. Then we can 18 Wood's unit can be calculated like this. If you want to calculate it with dyne, do you use here Wood's unit or dynes? I think you a lot of people worldwide use the Wood's unit. Is better, as actually easier. Any question? Never mind of this one. Let's. Can you calculate the pulmonary vascular resistance by the same concept? This is most important in the cath lab also. Let's have the pulmonary circulation. I told you that the systemic circulation starts in the left ventricle, go to the aorta, and pass to systemic circulation and return to right atrium. Who can tell me the origin and the final destination of pulmonary circulation? You. What's your name?
I am Mika. Mika.
all of you will engage. Yeah. You can use Indonesian language, and the doctor will join, will try to make me understand. Here, I have told you that systemic circulation start in the aorta, okay, and go in the systemic circulation and return to the right atrium. Tell me about the pulmonary circulation, where it starts and ends.
Darah dari vena cava superior dan vena cava inferior mengalir ke atrium kanan, kemudian mengalir ke ventrikel kanan melalui katup trikuspid, kemudian
Stop. This is she is continuing the circulation, but the pulmonary circulation starts here. Here's the beginning, okay? Blood, yes, but here is the beginning. Where is the end? This is the pulmonary artery. The blood flow to the pulmonary circulation. Then it ends where? Here. Mika? Yeah. In the left
left atrium.
left atrium. Excellent. Okay. Thank you. Then we will calculate also the flow and the cardiac output of the right ventricle. Have a look. In the pulmonary circulation, the right ventricle pumps you. Will come here after in the second question. In the pulmonary circulation, don't be afraid. In the pulmonary circulation, the blood starts, the right ventricle pump blood into pulmonary artery, then travel to the pulmonary circulation and return to left atrium. For blood flow from pulmonary artery to left atrium, the pressure will be higher in pulmonary artery and lower in left atrium. And the cardiac output that arises from the right ventricle to the left atrium, this is cardiac output, depends on the pressure gradient between the pulmonary artery pressure and the left atrial pressure. Look at this. Flow equal delta P over divided by R. Then pulmonary blood flow or the cardiac output of the right ventricle between the pressure difference between mean pulmonary artery pressure minus left atrial pressure over pulmonary vascular resistance. Who can write the equation? How to calculate pulmonary blood flow? I want to say pulmonary blood flow equal. By the way, pulmonary blood flow is the cardiac output of the right ventricle equal. Who can fill this? Who can write the equation? Okay, your name?
Aulia. Aulia.
Aulia?
Yeah.
Aulia. Go.
Mean pulmonary pressure
Okay.
di
Minus.
minus pulmonary vascular resistency to
Pressure gradient. Pressure minus pressure.
oh mean pulmonary artery pressure minus left atrium pressure,
Excellent.
pulmonary vascular resistance.
Above or below the line? Divided by? Yeah. She means divided by the pulmonary vascular resistance. Okay, let's calculate it. Can we, in the cath lab, can we measure right atrial pressure? Right atrial pressure? Sure. We can enter the right atrium through here, the neck and the muscular one and the sex packs. Okay. This is the patient. I think he is more healthy than you. And here, this is the jugular vein with the subclavian vein joining each other, forming the innominate vein. Innominate vein from here, forming superior vena cava. Superior vena cava to the right atrium. Right atrium to the right ventricle. Right ventricle to pulmonary. Okay? Again, this is internal jugular vein. This is subclavian vein. This is innominate or brachiocephalic. This is superior vena cava. This inferior vena cava. This right atrium. Right ventricle. Which valve is this? Tricuspid valve. Tricuspid valve. Okay? Okay. Then the aorta is here. And the left atrium is here. Left ventricle. This is the aorta. The aorta arches like that and descend in the abdomen. And bifurcate to iliacs and then femoral as you studied in the anatomy. Okay. Okay. Can we measure the blood pressure in the atrium? Yes, the right atrium. We can. How? We can enter by the catheter through the jugular vein. Okay, like this. This is the catheter. Can introduce the catheter through the jugular vein. Another way to introduce the catheter through the subclavian vein. Okay, can measure the pressure here. Okay, or from the femoral vein to the inferior vena cava to the right atrium. Can we measure the pressure in the right ventricle? Yes. Push this toward the tricuspid valve and measure the pressure where? In right ventricle. Can we measure the pressure of the pulmonary artery? Yes. Push it again here, the catheter will enter the pulmonary artery. Okay, I want to measure the pressure in the left ventricle. I will enter through the femoral artery, not vein, femoral artery. Femoral artery, then go to the aorta. This is antegrade or retrograde? Retrograde, the blood flow here, and we go against the blood flow. Push the catheter in the aorta, and then the arch, and then enter left ventricle. Okay? Can we go to the left atrium? No. Because the left atrium this is the aorta. Like that. Here, aorta, left ventricle, left atrium. Here is the mitral valve. You can enter by the catheter here, but cannot rotate it to against the bloodstream to enter the left atrium. So we cannot measure the left atrial pressure directly. The 4 chambers, we can measure only 3 chambers. This will be the MCQ written in the exam. Which pressure can be measured directly by the catheter without perforation? Okay? Right atrium can be measured directly, yes or no? Yes. Right ventricle, yes or no? Pulmonary artery, yes. Right aorta, yes. Left ventricle, left atrium, no. Then how to measure left atrial pressure? There are 2 ways to measure the left atrial pressure. The first one, here. As you know from anatomy, this is left atrium, this is right atrium, this is superior vena cava, this inferior vena cava. You can go here from the superior vena cava and puncture the interatrial septum. Then go to the left atrium, make perforation, and we sometimes do this in some cardiac interventions, okay? This one mechanism. The other mechanism is shown here. Go with the catheter from the superior vena cava or inferior vena cava to the right atrium, then to the right ventricle. You don't see. Then from the right ventricle to the pulmonary artery, and from pulmonary artery to pulmonary small arteries to the arterioles. Then do you see this balloon? Do you see this balloon? This balloon. We inflate the balloon. When we inflate the balloon, the tip of the catheter is measuring the pressure here in the capillaries that is connected to left atrium. Then it, as if it is calculating pressure where? In the left atrium. Because if the left atrial pressure rise, it will back pressure here. But you should wedge. Do you know the wedge? Wedge means if you have a tent and bring a piece of wood and in earth, yeah, wedge, the triangular, okay, wedge to be impacted, no flow around it, in order to measure the pressure, not the pulmonary, but in the pulmonary vein, not in the pulmonary artery, and in the pulmonary capillary, and in the left atrium. We call it pulmonary artery wedge pressure or pulmonary capillary wedge pressure. Okay? This is the pulmonary artery wedge pressure equal to the left atrial pressure. Who can make the calculation? Then here, pulmonary blood flow equal mean pulmonary artery pressure minus left atrial pressure over pulmonary vascular resistance. Pressure gradient above, below the resistance. Okay. I will remove left atrial pressure because I cannot measure it directly and put pulmonary artery wedge pressure. Okay. Then the mean pulmonary artery pressure, if the pulmonary artery pressure is 25 over 25, okay, this is 25 over 10. Can you calculate it? The mean? Who can calculate the mean pulmonary artery pressure from this? If the pulmonary artery systolic pressure 25 and the pulmonary artery diastolic blood pressure is 15, is 10. No one? Diastolic blood pressure plus 1/3 diastolic blood pressure plus 1/3 pulse pressure. Diastolic is 10. Pulse pressure 25 minus 10, 15. 15 over 3, 5. 5 plus 10, 15. Then it's 15. It's normally from 8 to 15. We will choose 10. Okay? Then the mean pulmonary artery pressure is 10. The left atrial pressure or pulmonary artery wedge pressure is 5. And this is 5 liters per minute. 10 minus 5 equal 5 by 5 equal 1 Wood's unit. The systemic vascular resistance was how much? How much Wood's unit? 18. The systemic was 18, and here is only 1. This will be a question in the MCQ. Who has the more vascular resistance, systemic or pulmonary? Systemic vascular resistance is much higher. We calculated it to be 18 Wood's unit, but this 1 Wood's unit, okay? The normal range from 0.25 to 1.6 Wood's unit. Then above 1.6, this is increase. Please know the normal range. Because when we diagnose pulmonary arterial hypertension or increase the pulmonary vascular resistance, if the vascular resistance is 2, if this one become 2, then the patient has a disease, has elevated pulmonary vascular resistance that necessitates treatment. Okay, pulmonary blood flow, mean pulmonary artery pressure minus pulmonary artery wedge pressure over pulmonary vascular resistance. I think, and this will be the end of my lesson today, and I am wishing to hear questions from you. Thank you.
Thank you very much, Dr. Medhat, for the great lesson today ya. Oke, open discuss. Ada yang mau tanya? Q&A session. Ayo tanya. First year, semester 1. Ada yang mau nanya? The second years, semester 3. The third years. Semester 5. Ayo. Pakai bahasa Indonesia aja, nanti saya bantu terjemahin, nggak apa-apa. Merci.
Okay, thank you, sir. I'm Mercy, and I want to give you a question. Why PCI, why PCI percutaneous coronary need a zeroing?
Yeah.
Thank you.
Okay, very nice question. She asked a practical question. Why in the percutaneous coronary intervention, or PCI, in the cath lab, we need zeroing? Okay, zeroing means we have 0 millimeter mercury pressure assessment. Let's draw it. For the patient that is lying on his back, okay? Like this. Here's the right atrium. The midpoint of the right atrium, this is the 0 point, okay? What's meant by the 0 point? Here, what is 0? 0 is atmospheric pressure, okay? But atmospheric, the absolute number is 760. But in the cath lab, we consider it 0, okay? Because any pressure above the atmospheric will be above 0. Then any pressure below the atmospheric will be below 0 or minus, okay? The pressure in the circulatory system depends on the height, because the pressure here is different from the pressure here, is different from the pressure here. If you have a tube filled with fluid, what's pressure? Pressure is the weight of the column above the point, okay? Here, the weight of the column, of the blood column, is just that. But here, the weight is the blood column, all of this. Here, the pressure, this point A, B, C. Which point has the highest pressure? C. Because at C, all this fluid press on it. So here is the pressure higher, his pressure is lower, his lower. Okay. If we put the 0 atmosphere here, here is the dome of the measuring dome. Do you know the measuring dome? The measure the position of the we measure it. If we consider this is the 0, okay. If we put it a little bit higher, what does it mean? Then it will be higher or lower pressure. If we elevated this, will be lower, okay? And if it is here, for example, when we calculate the right atrial pressure, we found the right atrial pressure here equal 5 milliliter mercury, okay? But if the manometer that measures the blood pressure would put here, we find it's equal 0. And if we put here, it is 10 millimeter mercury. Then, in the cath lab, number 1, try to put this manometer that measures the blood pressure. Try to put the manometer at the level of the right atrium, 5 centimeter below the manubriosternal angle here. Okay? Number one. Number two. This will be the zero. Zero means atmospheric pressure. Then the connection this is the blood of the patient, okay? The caster. Here is air. Here is the manometer. Do you know what's manometer? The device that measures the pressure. Okay. If you want to measure the blood of the pressure of the patient, then we'll close the air. Okay? This is a three-way. First of all, have the zero. Zero, then we will close here. If I close here, the pressure, the manometer will measure which pressure? Pressure of air, which is atmosphere, which is the zero. But please put this one here, not above or below. Then this will be the zero. Then change the lock and the lock here, open here. Then this will be the patient. If you don't take zero from the start, for example, if there is no zero, you didn't measure the air and make zero, you maybe measure the air and make 50. Then you will find this 150 milliliter mercury, although the patient is 100 only, because you didn't make zero with atmosphere. Okay, so it's a long answer, but in order to be short, number one, before measuring any pressure in the patient, measure the zero pressure. The zero pressure, not of the patient, the zero pressure of the atmosphere. Then open the manometer to the air. At which level? Here in the cath lab, or here, or here? No, in relation to the patient. The patient will lie, and this will be the zero that will be calculated. So if the table is below, we calculate the zero with the patient, not with the atmosphere. Okay? Very nice question, and the practical one. I'm very happy with it.
Okay, anything else? Ada lagi? Okay, maybe this is enough for lesson today, Mister. We will continue to hands-on on the cat lab, on the lab tomorrow, maybe.
Yeah, inshallah.
Sudah cukup? Ada lagi yang mau ditanyakan? Kita nanti lanjut hands-on besok ya di lab bawah. Jangan telat nanti datangnya. Okay, I would like to express our deep gratitude to Dr. Medhat for his enlightening us presentation and for sharing his expertise today.
Thank you.
Okay, I would like also to thank all participants today for active engagement and presence today. We hope this session has been meaningful and beneficial for everyone. Before I close this lesson, please take a set to take a photo.
Okay.
Bang Fajar minta tolong. Yang ini rapat. Okay, once again, thank you very much, Dr. Medhat. We wish you all the best and look forward to the future collaboration. With that, we officially conclude today's session. Wassalamualaikum warahmatullahi wabarakatuh.